First thing, trying to conceive, should you wait to get the COVID vaccine? The answer is no. And I'll go into that. Number two, if you get the COVID vaccine, should you wait to become pregnant? The answer is no. Do you need a pregnancy test before getting the COVID vaccine? The answer is no. Do we know of any impact that the COVID-19 mRNA vaccine has on fertility? We do not know of any theoretical or absolute risk of there being an impact on fertility. I mentioned on my last live discussion that there was something that was circulating, and of course, when it mentions fertility, it's going to spread like wildfire, and it injected a lot of fear into a lot of women. And as someone who went through infertility, I get it, but I'm here to tell you that that information was false, period. There is no indication that the vaccine is going to affect anyone's fertility, sperm, eggs, whatever. It's not. We do not have any indication that's going to affect that. Is there an impact on pregnancy loss with the vaccine? Again, it has not been studied in pregnant individuals, so we cannot say for sure, but we do not have any indication that it does. It's the first, a couple things, I went over this before. This is from ACOG, vaccinating pregnant and lactating patients against COVID-19. And there's 2 points I wanted to make, and I already said one, that you do not, where to go? Pregnancy testing should not be a requirement prior to receiving the Pfizer BioNTech vaccine, which is the one that's out now. They also said regarding individuals contemplating pregnancy, vaccination is strongly encouraged for non-pregnant individuals within the ACIP prioritization groups. Right now, the prioritization groups include healthcare workers and employees and residents of long-term care facilities. So if you are a pregnant healthcare worker or working in a long-term healthcare facility, you should be prioritized. There is no indication to withhold the vaccine in any trimester of the pregnancy. It should be offered to prioritized pregnant and lactating individuals regardless of where they are in their pregnancy. However, I have heard from many women across the nation that different hospital systems and hospitals, whatever you want to call it, are putting certain restrictions that they are putting on. Where I work, what we're doing is if you are a pregnant individual and you want the COVID vaccine in the first trimester, we are asking that you discuss with your OBGYN to make sure you are fully informed. It's a first trimester, guys, and I've been pregnant. I went through fertility. I get it. I would not have a problem with it, having that extra measure. But after that, if you want the vaccine, you can get it in the first trimester. If you want to wait till after the first trimester, you can wait till after the first trimester. If you don't want to get it all, you don't have to get it at all. There is no mandatory that the vaccine is mandatory in anyone, okay? But if you're at an institution where further restrictions are being placed because you are pregnant or lactating, you need to advocate for yourself if you want the vaccine. Now we're going to talk about what and I've been over this before, but I'm going to reiterate what the Pfizer and Moderna vaccines. They're both mRNA vaccines. They do not contain a live virus. These vaccines require 2 injection series at 21 days, okay? Or actually 21 days for Pfizer, and now it says 28 days for Moderna is the interval between the first and second dose. The vaccines deliver mRNA into cells near the injection site. The mRNA instructs our body's own cells to replicate the coronavirus's spike protein. So both vaccines target the spike protein on the coronavirus. This protein in turn is recognized by your body as a foreign generating protective This protein in turn is recognized by the body as foreign, which generates protective antibodies. So that's how you get the antibodies to help protect you from the coronavirus or COVID. The mRNA itself is rapidly degraded and does not enter the cell's nucleus. Specifically, the Pfizer vaccine is a lipid nanoparticle formulated nucleoside modified mRNA vaccine. The lipid coating of the nanoparticles binds to the cell membrane of our cells. facilitating entry of the mRNA segment into the cell. Rarely, some individuals could be allergic to a part of the lipid nanoparticle known as, it's called PEG, polyethylene glycol, a common component in other injectable medicines. Consequently, caution is advised when administering the vaccine to those individuals who have experienced severe allergic reactions to prior vaccines or injectable drugs. So if you have had vaccines to injectable drugs in the past or other vaccines, you need to talk to your provider about it and let them know, make sure they know. It is not yet known whether a vaccinated individual can spread the virus if they become infected with COVID-19. So I've heard that. So I got the COVID-19 vaccine, the first dose yesterday. Can I still spread the virus if I'm vaccinated? We don't know that yet. We know that it could protect me, but I don't know if I can still spread it if I get exposed to other people. And then 3, although a 2-dose regimen of the Pfizer vaccine is 95% effective against the development of COVID-19, it does not confer 100% immunity. Neither are the vaccines, the Moderna or Pfizer. I read that Pfizer has a 95.1% efficacy, and I think Pfizer has like a 94.2% efficacy. So, but that's not 100%. Okay, your individual fertility doctor, for those of you who are undergoing fertility treatments, may have other points they want to discuss with you. You can always ask them what they recommend. If you value, I'm assuming you value their opinion if they're your doctor. You can always talk to them to get more information. There is nothing wrong, guys, with asking questions. I feel like I don't want any individual who is trying to conceive, pregnant, lactating, all those things surrounding reproduction, to feel like if they don't get it, it's a bad thing. You have to make the choice that's best for you. And I do recommend, if you have questions, you have concerns, and you're on the fence, talk to your provider so they can help make the decision with you. That's the best person to talk to, not the mom group admin and social media, not who responds to your post on Instagram. Your doctor is the one who can help advise you the best because they know you.